Hello, everyone, and welcome to Discussability, a podcast produced by the Association of University Centers on Disability, AUCD. My name is McDonald Metzger, and
Christine Chalaka.
in this episode, we will be discussing AUCD. What is AUCD, and how is it important in the lives of people with disabilities across the United States? This year, AUCD is celebrating 50 years of advocacy, leadership, and support.
For more on what that journey's been like, I sat down with the AUCD Executive Director, John Chesida, to find out more. Thank you so much for talking with us today. It's an absolute pleasure.
Great to be here, Christine. Thanks for the invitation. Looking forward to the conversation.
Yeah. Now, I could go on and on about all the great qualities and accomplishments of this man, but I won't do it justice. So why don't you go ahead and introduce yourself and tell us exactly what it means to be the executive director of AUCD?
Happy to do that. Great question. So, in many ways, I view this as the capstone of my career. I've worked in the disability policy and research space for almost 30 years now. Since I broke my neck and acquired a disability myself, a spinal cord injury in 1993. I told myself after that, I was working at the Minnesota legislature at the time, that and I could see then how the systems and policies were not working for people with disabilities.
Right.
The way they were made was disconnected. The funding streams were all disconnected, and that I really wanted to make this my life's work. And I was fortunate enough to land with AUCD in 2017 as the Associate Executive Director of Research and Policy, and became the Acting Executive Director in January of 2020, and became permanent in that role in October of last year. So feel very fortunate to be working with a very smart and talented group of people within our office in suburban Washington, D.C., but connecting with people all across the country. And it's really the expertise, the broad and deep expertise of our network members that really is AUCD. They bring their passion, they bring their commitment, and they help change policy. They help change lives for the better for people with disabilities. So that's a long answer. I know that you've got questions for me, and we'll get into more of that. But again, thanks for the invitation.
Absolutely, and that is an astonishing answer. I mean, just having the opportunity to be involved with AUCD has been one of the highlights for me. So I'm just so excited to be able to sit here and talk with you. So could you tell us a little bit about AUCD? What is it exactly?
Sure. So AUCD is close to a $700 million network of university-based researchers, trainers, service providers, and advocates who advance policies and practices that improve the health and education and the social and economic well-being of all people with developmental or other disabilities, and their families and their communities as well. And I know that sounds like a mouthful, but what it really means is that there are thousands of people across the country, including trainees and emerging leaders in every state and territory, working with and on behalf of people with disabilities to make things better. So there's a total of 143 network centers across the country that often serve as a vital link between the academic world and the community. And if I break that down for you, there are 67 university centers of excellence in developmental disabilities funded by the Administration on Community Living, and they are very community living focused.
Amazing.
There are 60 leadership education and neurodevelopmental and related disabilities, or LEND programs, funded by the Maternal and Child Health Bureau. And I like to call that disability competency and leadership training. So for more than a dozen different health professionals, as well as family members and self-advocates, they engage in this leadership training and curriculum with an eye toward the future, and ultimately working with people with disabilities so that they're able to do that in an informed way. And finally, we've got 16 intellectual and developmental disabilities research centers funded by the National Institute of Child Health and Human Development.
Hmm.
And these scientists, often based in labs, are looking at underlying causes of disability, often studying things at a cellular and genetic level. So I started by saying that the network was incredibly diverse. So you can
Yeah.
see they're embedded in medical schools and clinics, as well as colleges of education and other settings focused on social sciences. But what they all have in common isn't just this passion and commitment to people with disabilities that I mentioned, but a commitment to training the leaders of tomorrow, building the bench of researchers, health practitioners, and service providers and advocates, again, with and on behalf of people with disabilities.
Hmm. Yeah, and I mean, that sounds great that there's an organization that's just solely dedicated to advocating and advancing individuals with disabilities. Could you talk a little bit about AUCD's inception? How did this organization come about exactly?
Great question. So, a little bit of a history lesson.
Mm-hmm.
Started with the Kennedy administration. So,
Oh.
actually, on Halloween of 1963, just a few weeks before he was assassinated, JFK
Mm-hmm.
signed a law that would get the wheels to our network starting.
Mm-hmm.
Was actually conceptualized by a guy named Robert Cook, Dr. Robert Cook, who was a pediatrician from Johns Hopkins. He himself
Mm-hmm.
had two kids with developmental disabilities, and he developed a close relationship with JFK's sister,
Mm-hmm.
Eunice Kennedy Shriver, in the late 1950s. And after JFK became president, Dr. Cook became a key advisor and a leader on this panel that was established to really look at how can we do things better for people with intellectual and developmental disabilities.
Mm-hmm.
And one of the recommendations that they had, well, a couple of key recommendations, really three foundational recommendations, and you'll
Mm-hmm.
see them reflected in what I've already talked about, what
Yeah.
AUCD was. One was training. Back then, there was a critical shortage of
Mm-hmm.
qualified professionals if the lives of people living with intellectual and developmental disabilities were going to be improved. Research and data, so hugely lacking. And this needed to be done at the university level was the thinking. And at the time, linking it to clinical programs. And we'll talk more about this, but remember in the 60s, a very medical view of disability.
Yeah.
And finally, looking at where this stuff was going to be done. So facilities and needing to provide funding for building facilities. There was a shortage of places to conduct the research, provide the services and the training for people with disabilities. And so those were the three key areas. But importantly, this panel also said that there's an essential role for government to fund these things, not just once, but on an ongoing basis if we're really going to make a difference in the lives of people with disabilities. So Dr. Cook really conceptualized this program, became its first director of what were then called university affiliated facilities. And the whole point was this need for interdisciplinary training with a focus on intellectual and developmental disabilities. They became laboratories for testing community centered services, employment, other things like parent training and strengthening families. And what was great about these centers was that they were addressing the needs that were expressed by the parents of kids with IDD at the time. And that's an important thing to note,
Mm-hmm.
that it was parents who were the chief drivers and advocates, specifically for parents of people with kids with intellectual and developmental disabilities. So
Mm-hmm.
I think the final point that I'll make in how this all got started, before any of this money and any of this attention was paid by the Kennedy administration, there really was not a significant number of universities across the country that were doing any kind of work in the IDD space, whether it was research, whether it was services. So this really was a huge catalyst, drove the creation of these programs and facilities, and really led to where we are today by creating a critical mass and allowing other researchers, other people to view it as a legitimate career to study and provide services for and to help through services themselves people with disabilities.
Yeah, so AUCD is really rooted in American history and culture.
Yeah, exactly.
So of course we have to mention that AUCD is celebrating its 50th anniversary this year. So congratulations, AUCD! Anyone listening that's part of the AUCDC network, congratulations. So, what's been the most challenging aspect of AUCD's 50-year career?
Great question. I think you have to look at, um, which was also a societal problem, and I mentioned this, making the transition from viewing disability through this medical lens to what in the late 60s would then be called a social lens. And that was a challenge, not just for our network, but for society in general. It's the difference between viewing disability as a series of medical challenges to be solved and addressed as limitations, or you accept the person with a disability as they are, realizing that it's really the interaction with the environment and with policies and practices that are actually more disabling than any physical or cognitive limitation that someone might have.
Yeah.
So I'll back up for just a second to say that it is important to note that if we go back to the history, when the network began, there were voices at the table representing both the medical and the more community focused and service oriented perspectives, but the money wasn't there for a long time to support that community focused viewpoint. In fact, it wouldn't come for decades. So some of this was bound up in the existing service models at the time for people with disabilities, not just the money that was available for community-based services, but remember, this was a very institutional time for people with disabilities. There was no societal expectation that people with disabilities would be active and contributing members of society, and certainly they wouldn't be expected to be integrated in the community. So again, the independent living movement didn't start until the late 60s with Ed Roberts and Judy Heumann and others. And I know it's hard for us to picture today how radical that thinking was at the time, given where we are now, more than 30 years after the passage of the ADA.
Right.
But not viewing disability as this problem to be solved was radical thinking in the 60s and when our centers were first getting started. So I think making that transition, and certainly they did it successfully, and I hope we'll get to talk about sort of the evolution of the network, and we can talk more in detail about that. But that was certainly a challenge for AUCD.
How about the most satisfying?
Most satisfying. As someone who's trained as a researcher and also with a foot in the public policy world, I have to say the advances in research that have also helped to change public policy, not just at the federal level, but at the state level, has to be one. I think looking at what we know now about certain rare diseases and conditions and the interventions that have been developed, not just to prevent them, but stop their advancing would be one example. Early diagnosis and assessment of kids with developmental disabilities in particular, connecting them with services so that they can lead full and active lives would be another. And now we have this very robust program that's funded by the CDC, Learn the Signs Act Early, which is designed to do exactly that, and getting kids in that service pipeline early so that they can get the therapies they need, get all the additional services they need, again, to be able to lead full and active lives. I think finally, just the sheer number of people doing this work in the disability field is impressive. As I said earlier, it wasn't until the legislation that was passed in 1963 and these university-based centers were built and up and running that others started to view this as again, a legitimate field of study and a career choice. So we've got these centers in every state and territory, and even beyond the AUCD network. The work that's being done, not just nationally, but internationally, with and on behalf of people with disabilities is impressive if you think about where we
Yeah.
were 50 years ago and where we are today.
Yeah, and you kind of took the words out of my mouth for the next question in terms of the evolution of AUCD's work over time. And so my next question is, how has the trajectory of AUCD's work changed over the past 50 years?
Okay, so before I answer that, I have to acknowledge this report that was written by Marvin and Bryce Fifield,
Hmm.
which really was the definitive history of the AUCD network. And I think this was published in 1995, so more than 25 years ago, but it really is the best document that's out there. And I'd be happy to provide that. I'll give my email address, or you can do that at the end of the program. But um, it really paints a wonderful picture of where we started and at least where we ended up in 95, and some of the challenges that were outlined there um, certainly are continuing to be addressed today. But to answer your question, in this report, they really divided the network into three phases of development. And I think it's helpful to think of it in these terms. So you have this sort of first generation of centers going from the early 60s until the mid 70s that emphasized, again, given the medical perspective at the time, clinical services, diagnosis and treatment, these interdisciplinary leadership training programs, which later would become known as the LEND programs that I mentioned, and doing all this in a single location. So focusing really on this sort of center of excellence approach. If we look at the second generation of centers from mid 70s to the mid 80s, that's when the community-based services come into the equation, and piloting new services and testing new concepts. And it's not an accident that we saw the start of the Medicaid waiver program around that time. And from a public policy perspective, more of a focus, starting to see a focus on community-based based living. So these programs in phase two also serving the full lifespan of people with developmental disabilities, and also looking at considering environmental concerns. So again, recognizing the onset of the independent living movement, it's not just people with disabilities and their issues in quotations that need to be addressed, but looking at the environment and the interaction with the environment. So third, mid late 80s up until when the report finished in the mid 90s, starting to look seriously at consumers, consumer empowerment, and making sure that there were voices at the table for people with disabilities. And all of those USAIDs that I mentioned have these consumer advisory councils now that are made up of people with disabilities and their family members that are guiding the work of those centers where people have a voice at the table. So you can see that evolution from the medical to the social,
Hmm.
and we've still got work to go, frankly, when it comes to including voices at the table, certainly underrepresented voices, but making sure that people with disabilities are there in meaningful ways and are helping to guide decision making. The focus of our AUCD conference that just ended last week was all about bridging these two worlds of the scientific community and people with lived experience, and making sure that people with disabilities are involved at every point in that process. They're not just subjects of research on the back end, but they're the ones who are there also helping to determine, what research is going to be done. How is this going to affect my life? Making sure that people with disabilities are on research teams and a part of the staffs within the centers as well. So I think looking at sort of those three phases give you a good sense of how the overall network evolved.
Yeah, thank you for sharing. And we see kind of now in American history where we are, there's been a shift within policy and legislation. So I'm curious, what do you see as the most pressing issue facing AUCD at this current point in history?
Well, I mentioned underrepresented voices at the table
Right.
at the end of my last answer there. So this question of equity is one that we've been focused on for the last year or so as a board and as a network. And as our outgoing board chair, Laura Good from the Georgetown University Center on Cultural Competence likes to say, we lag behind other fields in equity because we within the disability community haven't yet defined it and more specifically what exactly it means in a disability context.
Hmm.
I mentioned the theme of our conference this year. Last year, the theme of the conference was equity, recognizing the need for us in the disability field to be creating a national agenda in partnership with people with disabilities and their families and the communities in which they live to address the challenge. And we've spent the last year as a board wrestling with this. Many of our network centers are grappling with this. We know there are groups who have been absent from leadership, not just within our network, but in the broader community. The disability research that's been done has often been based on a predominantly white population. So there's a lot we don't know about different subpopulations within the overall disability populations that we need to know. And it's more than just research. It's how are we delivering services? Are we doing that in a culturally competent way? Our training programs, how are we doing that in a way that's bringing everybody along at the same time and not just the same rote curricula that we've been developing? How is that evolving? Because it needs to evolve. And we know we've got progress to make in diversifying the staff makeup of our network centers. So while we haven't defined equity as a network yet, we have looked at a helpful definition from the University of Michigan as a starting point that talks about equity as requiring ongoing action to both identify and eliminate barriers that prevent the meaningful participation and inclusion of certain individuals and groups. But this doesn't happen by accident, right? If you're going to achieve this, you need to invest. You need to invest the time. You need to invest the resources in the programming and supports that play to the strengths of people within underrepresented groups while also addressing their distinctive needs. So that sort of gets at this difference between equality and equity. It's not about treating everybody the same. It's about recognizing unique needs, recognizing the strengths of people in those historically underrepresented groups, playing to those strengths and providing the support they need in order to participate fully. So that's a huge challenge for society. I realize that. And if it were easy, we'd have solved it already. But it is something that we're taking very seriously within our central office and across the network. And our incoming board chair, Danny Armstrong from the Mailman Center at the University of Miami, very committed to this work as well. So I look forward to continuing.
Yeah, and I always say the key to equity is being intentional till it becomes second nature. Just going back to what you said, you have to be willing to take the steps and invest. And this is a perfect segue to my next question. Where do you see AUCD in 50 years from today, or hope to see?
So we talked about the history of AUCD really being driven by the parents of people with intellectual and developmental disabilities. And our roots and our legacy are always going to remain there with the IDD community. community and that commitment is never going to change. But over time, if we look again at that evolution of our centers over the last 50 years, most of those centers around the country are serving a much broader community of people with disabilities. It's not just people with IDD, but moving toward sort of capital D disability. So people with sensory impairments and conditions, people with physical disabilities that they weren't necessarily born with, and certainly the mental health community. And we know that these groups are not mutually exclusive, right? They're overlapping circles in many cases. So why is that? Why have they evolved over time? Well, yes, there are important differences in the community support needs and accommodation needs for people with intellectual and developmental disabilities compared to someone who's blind, for example. But there's much that they have in common. Access to transportation, access to employment, just two examples. So continuing to lead in the areas of research and training services, both clinical and community-based, and in advocacy for policy change for the broader disability community is one thing as I look out. Second, if I look at the last 18 months and the negative effects it's had on people with disabilities, we need to acknowledge that there are systems of support for people with disabilities that are pretty fragile. And I guess that's the nice way to say it. If I'm honest, I'd say that many programs and services are not working at all for people with disabilities.
Yeah.
And this was true before COVID, right? So AUCD needs to not just envision, but to help define what this looks like in the future. How can we take what we've learned during COVID, stop what's not working, and pay for what is? And there's emerging research giving us more information to help us with this in many different areas. And the good news is many of our network experts in healthcare, employment, higher ed, community living, for example, they're already doing this, envisioning what the service system of the future needs to look like, what those programs and services need to look like, how can we do a better job of integrating them, and most importantly, putting people with disabilities at the center. Not making them fit into the broken system that we have today, but starting with the person and wrapping services around that person. So if I look back to 1963 and think about the world that we have today and the huge role that the AUCD network had in getting us here, and then project forward to 50 years from now, 2071, I'm envisioning, again, a more integrated, flexible, effective world of services and supports that allows people with disabilities to be healthy, active, and contributing members of their home communities. And the deep expertise of the AUCD network, I think, will get us there. So again, we need to see more leaders with disabilities.
Yeah.
We'll see more diverse leadership as we continue to make the issue of equity a top priority.
Yeah, absolutely. And, it's been such a pleasure talking with you. And I just have my final question, which I personally think is the hardest or most challenging question of the whole discussion we're having. It's, what's one question that I didn't ask you that you wish I had asked you?
Oh, I thought you were going to ask me about COVID and how the work of the network
Yeah.
was affected by the pandemic. So I think I'll tackle that. And I can't say enough about how all three parts of the network responded.
Hmm.
Sometimes with additional money from the federal government, but often just diving in and doing what needed to be done because it was the right thing to do. Making phone calls to people with disabilities who couldn't get their services. All of us were locked down just to see if they were okay is just one example. One of our centers in the Southwest United States, driving people with disabilities and long distances in some of those big Southwestern states in order to get their COVID shots would be another. Looking back to the early days of the pandemic, dozens of our centers ramped up their telemedicine capabilities to continue to provide services or expand their services. And I realize that's not a solution for all people with disabilities, but especially in a clinical and mental health context, it's a very effective tool. Looking at things from a civil rights standpoint, people with disabilities had real issues getting access to services as states and hospital systems were deciding who was going to get access to things like ventilators back at the beginning of the pandemic when supplies were short, intensive care units were full, and AUCD centers were leaders in saying, hey, there are federal laws and protections for people with disabilities that don't go away just because we're in a pandemic.
Right.
When schools started to reopen, our centers were at the forefront in developing materials for families to do so in a safe and informed way. And researchers, again, in an educational context, were studying whether frequent testing and following safety protocols would help reduce the spread of the virus. And that research showed that it does. So, looking at today, and we've got a new grant from the CDC. AUCD is partnering with 9 different national disability organizations to conduct local outreach efforts to boost vaccination rates for people with disabilities across the lifespan, and not just people with disabilities, but their direct service providers and family caregivers as well. So, with these examples in a COVID context, again, you can see the depth and the reach of this network when you hear about efforts like this, and it's really just the tip of the iceberg when you remember that there are 142 centers of expertise across the country. So I'm just, again, thrilled and excited to be a part of AUCD, to be a part of this network. They are passionate, they are committed, they're doing this work for all the right reasons, and they're making great progress. That's really fun to watch. So I'll leave it at that. Probably talk too much.
COVID can be its own segment when we talk about the impact it's had on the disability community. So thank you so much for giving us just a little snippet of what I'm sure is a large conversation about it. John, it's been an absolute pleasure. I speak for all of us here at Discussability. Thank you so much for being our first guest. It was such a great discussion. And so I just want to wish you the best, and let's see what AUCD has to offer for the next 50 years, for the next 100 years. And so thank you.
Thanks for having me, Christine. Great questions, great conversation. I wish you luck with the new podcast.
All right, Christine. I think that was an interesting, a very eye-opening conversation, especially for people who didn't know much about AUCD. What do you think?
Yeah, it was a fun conversation to have. We talked about some great stuff and asked some unique questions. Got a little bit more knowledge on AUCD and a little bit more about his journey to becoming executive director. So yeah, it was fun.
Yeah, just listening to it. Put me in that kind of a festive mode, really, being just excited that AUCD is celebrating 50 years of advocacy, leadership, and support. I think AUCD has done great work, for the last 50 years. And for those of you who are not yet members of the network, or who do not know more about the network, please join us at one of the upcoming AUCD conferences. There's an annual conference every year that happens sometimes in November. Please, sign up to present a paper, join a committee or a council or a special interest group. That's where you really get to interact with members of the network. What will you say about that, Christine?
Yeah, I mean, and the good thing about AUCD is they have a very simple URL. So that's aucd.org. And so, the 50 years, they've been doing great stuff, and they have a lot more things cooking. And so it's excited. And hopefully you viewers can join us for the next 50 years of AUCD. So yeah, visit that website. Like McDonald said, there's conferences, groups, and councils. So just join us and help any way you can.
Great, great. And I also know that I know some of the center directors were able to do some messages. Um, let's hear about that.
Yeah, so celebrating that 50 years, we had some AUCD center directors come and send us a few messages to share with the viewers. So here's a few of AUCD centers directors just saying a quick happy birthday for the AUCD's 50th.
Congratulations, AUCD, on 50 years. This is Paula Rabideau, the LEND Director at Nisanger Center at The Ohio State University. I particularly want to call out AUCD's support of trainees and emerging leaders over the years. Your many programs on disability policy, evidence-based clinical practices, and diversity, equity, inclusion, and belonging for people with lived experiences and intersecting identities has and will influence our leaders for years to come. Thank you. Keep up the great work.
Hello, my name is Derek Willis, Director of Iowa's USED, AUCD at-large board member, former chair of Multicultural Council. I'm sending a message to congratulate AUCD on 50 years of service to the disability community. Wow, 50 years, what an honor. We appreciate all the support and technical assistance you have provided over the years, whether it's providing support to our network members through technical assistance, annual conferences, hosting our TA institutes, director trainings, starting with the orientation of new directors, facilitating daily calls, and all the things you do. The list goes on and on. I can still remember my first AUCD conference 18 years ago. What a ride it has been. Although I couldn't tell you how many times I've reached out for assistance, but I can tell you without a doubt that each time I reached out for assistance from AUCD, they responded in a timely manner and they were very helpful. My hope is that AUCD will continue to respond to the needs of our network members, and your commitment to innovation and excellence never dies. I'm comfortable in speaking on behalf of other USED directors saying that we cannot do what we do without the support AUCD provides. Here's to another 50 years of excellence. Thank you again.
Wow, AUCD, you are celebrating 50 years of success. That's just awesome. This is Amy Hewitt from the University of Minnesota's USED and LEND program, and I sure can't thank you enough for the many, many decades of your advocacy in ensuring that USED, LEND, IDDRCs, and other really important legislation at the federal level is passed to support community living and employment and all other aspects of community living for people with intellectual and developmental disabilities, as well as other types of disabilities. It's been such a benefit to those of us that are at the state level working in services and supports to individuals with intellectual and developmental disabilities. You've helped us in many ways with networking. I can tell you for sure many of my best colleagues are colleagues in other parts of the country, and for that matter across the world, that I've met through AUCD. Our programs benefit from your advocacy and from your work, and we certainly can't thank you enough. So congratulations again on celebrating 50 years of success, and I look forward to the many more decades that your organization will be helpful and continue to support the broad network of university programs that are involved in your network. Thank you so much.
All right. Happy birthday, AUCD. Thank you to our guest for this show, especially John Tishida, Executive Director of the Association of University Centers on Disability.
This has been an episode of Discussability, a podcast on the Association of University Centers of Disability, AUCD. You can also find us on Twitter at Discussability, that's at DISCUSSABILITY, and on YouTube. Discussability is produced by Christine Chalaka, Audrey Homan, and McDonald Metzer. You can find Discussability on iTunes, Google, Spotify, and wherever podcasts are made available. Music is Around the Bend by Evan Schaefer, used with permission. Thank you for joining us.